NEOM serves a very ethnically rich and diverse community. It is a socially deprived area of London. We decided to implement the UCL Partners Proactive Care Framework for Hypertension initially to focus on the higher health inequality gap in our population. The risk stratification and prioritization helped us identify high-risk cohorts which required a clinician's input right at the outset to minimize the risk to their health and achieve appropriate outcomes. So high-risk category patients were seen by clinical pharmacists, our advanced nurse practitioners, and our GPs. The moderate risk groups were addressed by our nursing colleagues and by our healthcare assistant, whilst our low-risk category population was seen by our health and wellbeing coaches and our healthcare assistants to support them. The risk stratification as per the frameworks has helped release GP time by prioritizing patients to be able to be seen by appropriate professionals from wider team. They have also managed to help patients be more empowered to take control of their health and well-being, especially in the low-risk category groups, through educational videos and leaflets and a virtual patient participation group. The collaborative working with UCL Partners team, where at every stage of the pilot they seeked feedback from us to adapt the pilot to the needs of the population, was key.
I just saw a patient last week who was referred to me for health coaching to reduce his cholesterol levels, and he hadn't seen us for the last 2 years due to the pandemic, and I picked up signs of angina and symptoms. So immediately we got the pharmacist on board who then reviewed his medication and addressed the angina symptoms, which were not serious on the day. So we then gave him more resources around from the British Heart Foundation around healthy eating, exercise to improve his diet and lifestyle. We also gave him a 24-hour blood pressure monitoring kit. We often use Accurex as a method to, communicate with our patients by sending them videos on health and well-being, and also do the voice group consultations, which we've been trained to do, seeing a group of patients together to improve awareness. So by doing all this, we are promoting an integrated approach to healthcare, improving patient care a lot, and improving the way we do our jobs. And as a result of all this, we are really addressing the health inequalities in NEOM, and a major concern being cardiovascular diseases.